Hello, and welcome to the Grow Patiently podcast, the podcast where we speak with healthcare leaders to discuss their wonderful journeys through the industry of healthcare and to learn from them, really. My name is Hugo Trace from growpatiently.com, where we help healthcare companies grow their businesses through various marketing channels. And today I'm with Dr. Matt. Hello, welcome. Please do introduce
Hey,
yourself.
hey, Hugo, thanks for having me. So my name is Dr. Matt Astin. I live and work in Georgia, in Macon, Georgia, exactly. I have many, many titles, but I think you're with me today. I'm with you today because I am the medical director of the Macon Volunteer Clinic. It's uh, a free clinic providing healthcare services to patients in and around my area that have jobs but do not have health insurance, so they fall through the cracks. That's one of my many jobs. I am double board certified in emergency medicine and internal medicine. So I do work in the emergency department at our level one trauma center up the street from where I'm at right now. Also am the team physician for Mercer University Athletics and the team physician for the Macon Mayhem hockey team. So
So you don't have a lot to be getting on with, I suppose.
not at all. Yeah.
Okay, so I always thank you for that. I always like to start with this question, which is I've never been to Macon and I don't know too much about it. So imagine I'm coming over, I don't know, in 3 weeks' time. What should I do? What do I need to see, experience, eat, drink, visit to really get that local experience?
Yeah. Well, Macon, Georgia is almost dead center of the state. So it's fairly easy to get to. We got a couple of big interstates there. So um, Macon has a history of music. Um, the Allman Brothers are from Macon,
Oh,
Georgia. James Brown was born in Macon, Georgia. We have a lot of music history related to this. The Capricorn Studios, where the Allman Brothers recorded a lot of their music, is here in Macon. It's actually a museum now, so that would be something definitely to look into. We have a lot of historic homes in Macon. During the Civil War, when General Sherman had his, historic march to the sea, where he burned Atlanta, Macon was bypassed. So we have a lot of pre-Civil War homes in the area. So, and as far as food, there's a place downtown called the Rookery, which has some fantastic burgers and things like that. So those would be my things to say. Hey, let's do that. So, and
great.
if you're into arts, we have two local theaters that are community based. One has been around for almost 90 years, and the other one getting close to 35 years, and both of them are professional quality, considering that they are local volunteers doing their jobs. So,
Good stuff. Well, you've certainly sold it to me. And next time I come to the States, I'm going to have to swing by. Okay, well, let's dive into it. I think let's start by talking about the clinic that you're working for now, Macon Voluntary Clinic. Why don't you tell the listeners a little bit about how that works, maybe the mission behind it, and also the fairly complex for those listening outside of the US, what's the word? Sort of landscape of insurance and how people fall through those gaps and then need your services.
yeah. So the Macon Volunteer Clinic has been around for a little over 20 years. And what we do is provide, well, technically it's a multi-specialty clinic, but the primary focus is primary care, kind of health maintenance, health prevention. We were established to take care of those patients, like I said in the opening, that have jobs but do not have insurance. So healthcare costs in the United States are skyrocketing, of course. And so the way the insurance thing works around the landscape here in the States is unless you are at a job that offers insurance through your employer, it is very difficult and expensive to get insurance unless you qualify for some of the government subsidies, such as Medicare, Medicaid. So that's where people fall through the cracks. If they are under the age of 65 or don't have certain chronic medical conditions, they do not qualify for Medicare. If they make more money than the Medicaid cutoff, they don't qualify for that. And then if they don't have the job where the small business employers can't really provide insurance. So therefore, these people fall through the cracks. So That's how we came into being to provide care for those patients. So we do have a fairly strict eligibility criteria. You have to live in our area, number one, but you have to have a job and you have to make less than 150% of the federal poverty level, which is set every year. And you cannot have insurance. That's how we kind of get through this. We provide free services, like I said, mostly primary care, but we have OBGYN care. We have a dermatologist that comes. We have a neurologist that comes and visits. Um, and those are the big ones. And we have some partnerships with some local providers, other specialists that will see our patients at no or reduced cost. So,
Mm. Yeah, it's incredibly important work. It sounds like what you're doing, and I'm sure the people in your community are really, really grateful for what you're doing. And so it's fascinating to hear the story that you're sharing, really. So I'd love to dive into a little bit about. I know that you have a long, illustrious career for the many twists and turns that have led you to this
oh,
position. Give us some of the the ups and the downs, the roadblocks, the challenges, the good stuff.
yeah. Well, you know, I've been a practicing physician. Let's see, this is 2025, so 20 years now. And so when I came out of my residency training, I just basically started working and then slowly began getting into leadership positions. I've been about 3 years out of residency. I became the medical director over a couple of emergency rooms a little bit farther south from where I am right now, working for this company. And for the next 3.5 years, I was with that company as the medical director for several different hospitals, emergency rooms around the state. Ran into a couple of roadblocks, being a young leader and not having as much experience. So that kind of had a little fall from grace, so to speak, related to that. So got lost that directorship and just went back to being a regular, regular pit doctor is what we call it in the emergency room. Um, but learned a lot of lessons over the years related to that. So I was starting to reach out a little bit more. Wanted to get back into the leadership game and as directorship, and then this opening popped up at this clinic. Um, so, like I said, it had been here, been around for. We just hit the 20-year mark a year or two ago. The original founder was around for quite a while, and once he retired and stepped away, they've had directors kind of come and go, and so the opportunity arose. I, stepped in, and I've been here. January will be 5 years. So I think that's the longest running directorship in quite a while. So this fit really well with my background and experience. Like I said, I mostly work in the emergency department, but I do have that internal medicine primary care side. So that allows me to kind of help guide what's happening here, but also being in this community. This is where I went to undergrad college as well. So I've actually been in this town for over 30 years, minus my residency time. So this community means a lot to me, and so this is a way that I can give back to the community.
Yeah. Interesting. I was thinking as you were saying that you must have something that you sort of wake up in the morning and you think about this is why I'm doing what I'm doing. This is why I'm dealing with all these difficult things that no doubt you deal with every day. Would you be happy to share a little bit about what is that why that you have that helps you overcome anyhow?
Well, sometimes I ask that question myself. Why am I doing this? Now, I've always had that drive, so to speak, to be the one to do something, to help something. That was one of the reasons I became a doctor. I liked the solving the problem and fixing things. In that case, saving a life or starting that process. So I think that the way that fits into here is the longer I've worked in the emergency department, I've seen so many people come in for non-emergency things because they don't have a primary care doctor or they don't have insurance to get in to see a primary care doctor. So it was more of it's not really more of a, it's an example of maintaining my sanity in the emergency department by helping this side of it. So I can come in, I see these people that they have real problems and they get frustrated as much as I get frustrated because they don't want to come and wait 8, 9, 10 hours in the emergency room for something that could have been taken care of weeks ago that they just couldn't do it. Um, so I do this I get up every day and go do everything that I do um, to be a resource to those that need it. I feel like I have that need to bring people to a place where they can succeed. And I do that not only here at the volunteer clinic. That's the reason I do my athletic stuff too, because these kids and these athletes, they are out there trying to play the game, and there are so many benefits related to that. So I want to be able to help them do that as much as they can. So um, that, and I'm a little selfish, and I enjoy going to the games for free and reliving my glory days back many, many years ago. No, it's just I have the ability to provide care and services to help people live their and fulfill their goals. So that's what I like doing. So
That's lovely to hear. I picked up this phrase from someone called Trevor G. Blake. He runs a series of healthcare businesses, and I've it's loosely what I have as our sort of mantra, shall I say, our mission for our business, which is have an impact on someone else's life and do it with a smile every day. That's the goal of what we're trying to do. And I used to be a teacher, so I tried to do that in teaching. It's a lot harder to do it with a smile when you're a teacher,
yes.
but in the marketing space, it's easier. So tell me, I want to talk about sports, so I just can't help it. I'm a big Leicester City fan. For anyone who listens and watches my content or anything, I do talk about it a lot. That's a soccer team or a football team in the UK. We
Yeah.
had, I don't know if it made it over to the States particularly, but we had this one unbelievable season where we just went up the levels twice and then won it, and it was just totally unheard of. And now we're back down. But what can you
Yeah,
do?
we see Champions League every now and then, and so you see
Okay.
we get
We even made
relegated.
it to
So
that, you know. We
yeah,
were playing sort of tiny little crowds of 10,000 when I first went to see them. And then next thing you know, we're in Madrid watching them. Anyway, tell me about what you're doing with the sports team and things like that. 'Cause it's really lovely to hear about how it has that same goal that you see what they're trying to achieve and all the great things they can get if you can
Mhm.
make sure that they don't hit injuries and roadblocks that totally changes their life, you know.
Oh yes. So yeah, I work with Mercy University, so we're a if you look at the college landscape in the United States, you have your very large schools, the Notre Dames, Alabamas, Georgias. We're on the level right below that, what we call the Football Championship Series, FCS. And so all of our sports kind of fall in that one tier down. I started, so I went to Mercer University undergrad, so I always had had a little place in my heart this whole time. And then back
Die
in
Hard fan.
yeah, well, in 2013, they started the football program back again. They originally had football back in the 1920s, and for several years, but World War II, they ceased playing, and they just never did it. But they came back in 2013, and I joined on with the football team at that time. And just being there, I get to go to the games, but I don't enjoy riding buses very much for 4, 5, 7 hours, but but the food is good. Um, and then in I believe it was 2016, maybe it was around there. The dates all run together of when I started doing all the other sports as well. Unfortunately for me, it was the year after our men's basketball team defeated Duke in the NCAA tournament, so I was not there for that. Uh, and we haven't been able to make it back yet on the men's side. On the women's side, I've gone to a couple NCAA tournaments, so I was an athlete growing up, and all the normal baseball, football, basketball, everything. And when I went to Mercer, I walked on the baseball team. I didn't get to play, but I ended up ended up joining the cheerleading squad. So I was a
Love it.
cheerleader for 3 years, and I actually coached them for 2 years. I went to the national championships in Daytona Beach, Florida, my last year of competing. So the sports have always been there. And so I still live vicariously through my athletes that I see. And it's same thing with the hockey team. These are uh, semi-professionals. I mean, they are professionals. They get paid to do what they're doing. That it's a very low league, about 4 levels below the National Hockey League. So these guys are playing because they love to play. So. Um, it's the same thing. I go, I'm there to take care of their non-orthopedic issues. I don't do orthopedic surgeries, but concussions, sprains, tweaks, any kind of illness, I'll take care of that. And in hockey, I have to sew some faces up occasionally because, hockey players. So no, it's great, with my football team, with Mercy University, we've gone to the playoffs the past 2 years. Last year, winning the conference championship for the first time ever for Mercer, and then last week we won our game to we are repeat champions for the first time forever for
Congratulations.
us. So yeah, so we have homecoming this week, so it's going to be a chance to go undefeated during the conference season this year before we head to Auburn University next week for our big FBS paycheck. Uh, and then the playoffs will start again. So, we've done. I've got to see some really interesting places, some really fun things, and it's really heartwarming to me to see players that I've had to deal with, even if it's just doing their physical before, progress farther than Mercer in their sports. We've had several baseball players make it to the major leagues. We haven't had a football player yet. We were very close this year. We had one player that made the New York Giants. He was going to make the team. He was doing well, but he broke his leg during a preseason game. So that was disappointing for
Yeah.
him. But when I see a player that I helped get through their however many years at Mercer doing their sports, trying to keep them healthy, getting them out there, getting recovery as much. When I see them in a professional uniform, that makes me feel really good. So,
Oh, I can only imagine. I mentioned I was a teacher, and sometimes I get people message me on Instagram saying, "Oh, sir," they call you sir. They say, "Oh, sir, I got like a first at uni or whatever," and I just wanted to thank you for helping my
yeah.
essays. It'd be a whole different game if they're playing for the Giants. Um, wow. So, okay, you spoke a lot. I sort of in amongst there, I felt like you were talking about how uh, there's a lot of crossover between the care that you're providing for these athletes and the care that you provide for others in your medical career or less athletic side. And I was wondering, I presume that there's also a lot of crossover, I think, between sports in terms of leadership and teamwork, and how that translates into your directorship role, because you've spoken a lot about leadership as well. How do you find those two as an athlete, as someone who's clearly still in love with uh, athletic pursuits and sports? Do you want to just share a bit of that? Because some people don't care about sports, and actually, I think
Yeah.
that's really interesting.
Yeah, I mean, there's so much crossover because on in the sports thing, especially in team sports, not as much in solo sports, but even in those solo sports, there is a team around that athlete. So these team sports, everybody has a position. In football, you have your quarterback, you have your running back, your wide receivers, your linebackers, defense. Everybody has their position, but they have to work together to get to their common goal. And so that's where the head coach comes in. So that's the leader of the team. In the medical side, in my clinic here, I serve as the coach for all of my staff, all of my volunteers, to get them, they are doing their roles. They have their own positions, but I have to coordinate them, get them to work together to reach our goal, which is the care of the patient. It's the same thing in the emergency department when, I have a critical patient comes in, there's, a trauma or cardiac arrest. I have a team of people doing specific jobs, but I am there coordinating it. And if we can all work together and everybody does their job and there's support for them to do their job, that's when we have good outcomes. We can save a life. So,
Mm. Yeah, incredible. I do think it's incredible when it's to do with life and death. I mean, that takes leadership compared to my leadership of a marketing team or when I used to run a department at school. It's quite a different game. So I'd love you to share. Let's talk about leadership because I mean that's the role that you have in your business and it's really, really intriguing to me. And I know that the listeners will find it interesting to think about how, your leadership style and how that incorporates into what they're doing. So maybe let's dive into, let's start with the nicer side. How do you keep people motivated who are already motivated? And how do you keep them playing their position, for example, at the peak level?
yeah. So the first thing is to make sure they're in the right position. As the author Jim Collins said, it's one thing to have them on the bus, we got to have them in the right seat on the bus.
Mm,
So that's it. So if they are in the right position, they have that passion for themselves. So my job as the leader is to support that, to not put any roadblocks up that's going to hinder that passion, because I want them to continue to grow that. And progress, in their own goals and dreams. Um, so that's what I try and do here at the clinic is this is what you're doing. What can I do to help you do your job? And how can I help this person and this person work together to get the common goal? So a lot of human factors involved. So
and one of the things I try to do is I ask people, what are you trying to achieve beyond what we're doing here? Like what's your goal? I know what I want to do. I want to build this business massively and I want to do X, Y, and Z. But what about you? That's
yeah,
probably not your number one goal. That's something else. And then if I can get that goal to fit with others' goals, then that's when the magic starts to happen and they
absolutely.
feel like you're helping them through that. How
Yeah.
about when when people are not doing so well? When people are potentially in the wrong position or when they're just not quite doing what you think they should, how do you
Right.
approach that? Because that definitely happens a lot.
A lot. So, well, it's having that conversation, having that relationship with that individual, so that you can have that open and candid conversation. So, are they not doing well? Are they not enjoying it because they're in the wrong position? They would be rather be doing something else. If so, can I find them that position? Can I move them around to get to where they want to be? Are they not doing well because they are lacking some kind of education or some kind of training that if I provide it, they will come up to speed? So it's identifying the reasoning behind the lack of success. And then what steps can I do to work with that person to find the success, whether that be in the position they're in, whether it's in another position in a company, or if it's even finding them another or helping them find another position outside of this company. So,
Mm.
because it's all,
Softly said.
yeah, yeah. So, well, it's not, it's not necessarily, hey, you're going to be fired.
No.
Sometimes it has to happen, but, that doesn't help that individual, so sometimes, it can't be helped. It has to be done. But if you can find a way to help that individual, succeed in whatever uh, avenues they want to pursue, that's going to come back on us in a positive way. So if I can, if somebody doesn't work well with this organization and we come to some kind of agreement, say, hey, you would rather do this. Hey, I know somebody over here. Let's see if they can help you out with this. All right, well, I've helped them and that I've helped this other person as well. So at some point it may come back to me. They may find something I can need. So it's always trying to figure out what I can do, not only to help my own people, but to help the ones around me because that's eventually has the opportunity to help me. It's not going to hurt me.
That's just it. How often do you dip into your coaching and leadership when you're in your medical role in the sports teams? When you're
Yeah.
chatting to these young people and they're like, oh, I just want to, I don't know what they're like. They want to get a big watch or something.
Yeah.
And you're like, focus on this position or that.
Mhm. Well, in the emergency department, it's a little bit easier to do that because they have definite identified roles. Scope of practice kind of limits doing extra stuff. However, if I know somebody is interested in doing more or learning more, I'll have them, you know, not necessarily do it, but be where they can see it being done. If they ask questions, that is a cue to me that they are interested in learning more, doing more. So I love when people ask me questions about things, and then I'll start asking them questions. So I'll see that, and a lot of times it's with our the newer employees, the ones that just get hired on, the ones that have been there for 15, 20 years, they're happy with what they're doing. It's a lot more fun to make sure they don't get disgruntled and and bring the morale down. And sometimes the new people do that too. But that's where the coaching side comes in, the sports side comes in, is you know finding the people that want to improve, want to progress, and then providing them the resources to help them to take that next step. So, and by doing so, that takes the whole team up higher.
Yeah, sum of all the parts and that kind
Yeah.
of stuff. What about growing the clinic? And naturally, as my marketing hat
Mhm.
gets put on, I do think about that. And your clinic is very interesting because it's a voluntary clinic, which is
Yeah.
pretty remarkable. So it means that this mission that you have, that you've told us all about, everyone must feel that, otherwise they wouldn't
Mhm.
do it. But you mentioned to me you're not the only clinic of your type, of similar type in the area. And how do you go about making sure that people are aware of what you offer, that people tell more people, for example, and you're
Yeah.
able to expand your impact?
Mhm. That is the issue we are dealing with right now. We earlier this year we moved to a newer clinic, so we're actually in the downtown area, so it's a lot more visible, much bigger building. So we are known in the community, but we have not in the past done a lot of true marketing for this clinic. A lot of that has to do with budget constraints because we do not take any federal government money. Everything that we operate this clinic on donations and grants. So if it's not there, it gets gets dropped. So a lot of the stuff we have done in the past is just going door to door, so to speak. But using the Chamber of Commerce, going to some of the local restaurants, to the hotels that have these workers that are there doing their job because they want to work and they're doing a great job, but they don't make quite enough money, and they don't have the insurance. So getting that out. One thing that's what we've done. Um, One of the things that I want to start doing is, yes, we have sent information out to those kinds of employees to do, different thing, kind of workers groups, that type of thing. Why don't we reach out to the donors, the ones that have donated to us, and say, hey, look, we're looking for more patients because these people are business owners. They know other business owners who have employees that would qualify for us. That's a stream of patients that we haven't touched that much. So we're looking to do that. Now, on the other side, like I said, we are a volunteer clinic, so I get paid here, but I don't see patients. It's more of an administrative role. I have a nurse practitioner on staff that she gets paid. That's the only other provider that I have that's here every day. Everybody else is a volunteer. So either they are retired physicians or they take time out of their practice to come help us. So recruitment of those volunteers is always tricky. So that's why I'm dressed a little bit fancier today than I normally do because we have our hospital medical annual medical staff meeting tonight. So I'm going to hey, go the whole politicians shaking hands and kissing babies type thing. So
I thought it
trying
was
to
for
get
me.
yeah, yeah. So so that's it's a two-pronged marketing type thing, not only for the patients but for the providers as well. So
Sometimes when you have the limited budget, that's when you're forced to be your most creative. And
Absolutely. Yeah.
often you end up doing things that obviously are lower cost, lower investment. But at the same time, it's almost, I don't know, exponentially less budget wise because no one else is doing it. So
Right.
going door to door, for example, no one is doing that now. Everyone wants to do a Zoom and click through and then it's just
Right.
done.
Mhm.
Uh,
And same thing. We in the past have done a lot of social media type things, but we're limited. A Facebook post only works if the person that is following you to see it. It doesn't get broadcast. That's the way it is for most of the social media. If you're not a follower, you're not going to see it unless somebody shares it, and we don't have a lot of people sharing. So it's the boots on the ground, having those relationships with the employers to funnel, people to us. That's where we will grow. So
yeah. So on some platforms, things definitely are changing. I'd have a look back
yeah.
into that just while I'm here because it's a massive time drain, that's for certain.
Yes.
But the there is an element now that followers, that level is far less important. So people
Mhm.
with tons and tons of views, especially for example TikTok, which I know people think is just for kids, and it nearly got banned in the US, which was quite an interesting
Yes.
story. But that one you can, and I haven't done this, but you can make a post and it can have 1 million views when you
Mhm.
only have one follower. Really, it's very strange. It's sort of flip the model. So
Yeah.
I just mentioned that,
Sure.
seeing
Yeah.
as you mentioned it.
Well, the problem is not the right word. The limitation I have there is who's going to be doing it.
Yeah,
No, I don't have a staff. I have a volunteer coordinator that does a lot. She's one of our, I think she's our youngest employee, but she's more working on volunteer schedules and that type of thing.
yeah.
Occasionally doing this. So, all of us, old people, have a hard time, branching out into the social media world. So,
Yeah, of course. You need a volunteer from one of the sports teams or from one of the
okay.
schools. That would
Yeah,
be a
well,
good
we,
one.
we we have a lot of undergraduate students that come in as volunteers, as medical assistants or administrative. So I was like, let's task one of them with this.
Yeah,
So yeah,
they'd love it.
yes,
Great. Well, it's been so interesting hearing about all these things. I mean, I love in particular thinking about the crossovers between sports and work or business. It's so intriguing to me, and the things that you shared about leadership are really valuable and interesting. I always like to ask this question, which is sort of the wrapping up question, which is that if you could go back to see Dr. Matt 20 years ago, or maybe you would have just become Dr. Matt, so who knows, but around then, and give them just one piece of advice, that's it. What would that, and in business and healthcare related, not uh, go and buy Bitcoin, for example, which someone did say to me the other day. Fair enough, I didn't give the caveat.
yeah,
But yes, what would be that one piece of advice that you'd give them?
yeah. Well, one thing would be I'd have a little bit more hair back then. But the no, and this is what I would have told myself back then is. Um, Especially in a leadership position, in a new leadership position, do a lot more listening and gathering of information before you start, getting going out there and trying to make change or bolster this or whatever. Um, so do a lot more listening, get to know the people because as a leader, there's only so much you can do. It's your followers, so to speak, the ones that will be doing the work, and they have to believe in you as the leader to do what you as the leader want them to do.
Mm,
So listening more and building relationships more.
yeah, I love it. Okay, well, as we round this interview, this podcast up, I'd like to say a massive thank you to all of you who are listening. I have mentioned in the last episode, if you saw it, that we have a new tax for listeners, which is just a simple this, that if you took just one thing that you enjoyed, you learned, you laughed, you cried, something like that, then please do pay the tax, which is simply that you tell one other person about it. Because if we've got good things that you're learning, hopefully other people can learn that too. But other than that, I want to say a massive thank you to you, Dr. Matt. I really do appreciate you coming and sharing your story. And I always offer an opportunity for people to potentially find out more about either yourself, sometimes online, maybe not on social media, bearing in mind what you said earlier,
Yeah.
and the business, the clinic, maybe even the sports teams, any plug.
Yeah. Well, I do have, there was a couple years back, I was big into the social media for emergency medicine. So I do have all the tags. Everything is M Astin, MASTINMD it's called X now as opposed to Twitter. Instagram is all the same thing. I don't put a lot out there as much as I used to, but it's still there. As far as the clinic, it's Macon volunteerclinic.org. I'm pretty sure we have a website. We definitely have a Facebook page for that. And then it's Mercer University. Mercerbears.com is the athletic side of it, and it's got all the information on there with the news of what we're doing, and it's homecoming week, so big game. So
Yeah, lots to celebrate. Well, enjoy it. I'll be thinking of you in a couple of weeks. I mean, I was certainly not part of the team, but I did go to the celebration for when our team did win something, and it was something special. It
yes,
really was. So I hope you enjoy it.
yeah,
Um,
I really enjoy the championship rings when we get those because I don't know you're not expected to wear those things around. They're just massive. So
they're massive, aren't they? Yeah.
yes, they are. Yeah.
You just pop them on for interviews, I think.
Correct. Yeah. Or put them in a display case at the house. Yes. So,
Exactly. All right.
yeah.
Well, Dr. Matt, thank you so, so much. Everyone who's listened, thank you so much as always. And I'll see you next time. Thank you, Dr. Matt.
Thank you so much.